Doctor, we've seen so many lockdowns overseas, especially the very developed nation have done that. We can mention America, Italy, Spain, and UK as well. But in African nation, like a very poorest nation, we can mention Ethiopia. So such promising jobs are undergoing these days. What will happen if a complete lockdown effected for that lasts for 2 or 3 months in the economic sector? The impact of lockdown on the economy.
Interesting question again, because if we see some of the countries in Europe and the United States where lockdown had a negative effect on the economy, but you can see also countries that have managed the virus without such lockdowns. You can take Taiwan, South Korea, New Zealand, Norway, Germany. And incidentally, all these countries are led by women. Their prime ministers are women. They've been very successful. They had very low death rates. They have very low infection rates. But they didn't lock down the economy. I think the main problem with the virus is not a question. Yeah, they took on preventive measures before. As soon as they knew, and the World Health Organization, Dr. Tedros, announced that this is going to be a global pandemic in March, then they took measures, immediate measures to stop. In Italy, they didn't. In Spain, they didn't. In Britain, they didn't. In the US, actually, President Trump was saying, oh, this is a flu, it's going to go away. Definitely. So it is a question of the structure of the health system and the speed at which the governments responded to this. When it comes to Africa, we're not going to go into lockdowns. We've seen it in Nigeria and South Africa, which has created violence, which has people cannot eat anything. In fact, a famous story in Kenya that came out of Kenya is the woman has 8 children. Her husband died because some gangsters killed him. What she used to do was she was cooking stones in her house, because the kids would see that some food is being cooked, so they would go to sleep without food. So it became viral, and now she's getting a lot of support from donors. But the problem is, in Africa, ILO has said this very clearly. We cannot have lockdowns in Africa. We have to have, of course, social distancing. We have to have the health system in place to be able to check on people who have the virus.
You mean lockdown shouldn't be practical because the majority of the nation live in a hand-to-mouth situation?
Yeah, this is a hand-to-mouth economy. If you take Ethiopia, for example, those people who buy and sell at the gullit are people who live literally on a daily basis. So if you lock them down, then the government has to be able to provide food. Now, even the United States, the biggest economy in the world and the biggest producer of food in the world, is having problems to feed its population. The food banks are empty, even in the US. So I think in our country, what is important is the political authorities in Ethiopia, the government, opposition political parties, religious leaders, social organizations. We have social organizations in Ethiopia that have outlasted governments, like the Gada system, the Mahabars, the Idders, the Baitos. These are all legitimate organizations in community. You can use these organizations to be able to get the message directly to the people. So one way is, of course, I have seen it when I was in the United Nations, permanently working there. HIV/AIDS was a big problem. We knew HIV/AIDS was a serious problem after it killed village after village. The same thing now, I'm here as a trustee of Africa Humanitarian Action. We support about 22 million refugees and internally displaced people in Africa in this office. When Ebola came, we only found out after it killed 3,000 people in one village, literally in several villages. So Well, because, you know, the health system in Liberia at that time was failing. There was a civil war. There was not a permanent government that could provide health services. So, after that, in cooperation with the African Union, we sent medical doctors from here. And we saved a lot of lives. Actually, the Liberian government gave us a certificate and an order for that. With the coronavirus now, if we had it spread in Ethiopia already, you would see whole families and communities dying. Fortunately, our government has taken good precautions so far. So these precautions are very important. So instead of locking down the economy, as soon as you have a patient, what the epidemiologists do is they go and trace if that person has been meeting other people who could have contracted that virus. So one is we have to keep our health systems very strong. Ethiopia has a very strong health system at the grassroots level. It has developed it. When Dr. Tedros was the Minister of Health here, when now he is WHO Director General, one of the reasons he was elected to WHO heading is because of what he did in Ethiopia.
You mean the lockdown shouldn't be practical because majority of the nation live in a hand-and-mouth situation?
Yeah, this is a hand-to-mouth economy. If you take Ethiopia, for example, those people who buy and sell at the gullit are people who live literally on a daily basis. So if you lock them down, then the government has to be able to provide food. Now, even the United States, the biggest economy in the world and the biggest producer of food in the world, is having problems to feed its population. The food banks are empty, even in the US. So I think in our country, what is important is the political authorities in Ethiopia, the government, opposition political parties, religious leaders, social organizations. We have social organizations in Ethiopia that have outlasted governments, like the Gada system, the Mahabars, the Idders, the Baitos. These are all legitimate organizations in community. You can use these organizations to be able to get the message directly to the people. So one way is, of course, I have seen it when I was in the United Nations, permanently working there. HIV/AIDS was a big problem. We knew HIV/AIDS was a serious problem after it killed village after village. The same thing now, I'm here as a trustee of Africa Humanitarian Action. We support about 22 million refugees and internally displaced people in Africa in this office. When Ebola came, we only found out after it killed 3,000 people in one village, literally in several villages. So, well, because, you know, the health system in Liberia at that time was failing. There was a civil war. There was not a permanent government that could provide health services. So, after that, in cooperation with the African Union, we sent medical doctors from here. And we saved a lot of lives. Actually, the Liberian government gave us a certificate and an order for that. With the coronavirus now, if we had it spread in Ethiopia already, you would see whole families and communities dying. Fortunately, our government has taken good precautions so far. So these precautions are very important. So instead of locking down the economy, as soon as you have a patient, what the epidemiologists do is they go and trace if that person has been meeting other people who could have contracted that virus. So one is we have to keep our health systems very strong. Ethiopia has a very strong health system at the grassroots level.
Okay, recently the General Director of WHO, Tedros Adhanom, has said now the pandemic has turned its face to Africa. Africa is going to be the hot spot of the virus. In this case, it has political, social, and economic impact, isn't it? Talking about Ethiopia specifically, what has to be done to safeguard our economy from the free fall?
Well, you see, the government so far is doing a tremendous work on this. For one thing, for example, since the Japanese national was found here with the COVID-19, they've been tracing people that are coming into the country. They have quarantined now people coming into Ethiopia. But we have major challenge. One is those who are now coming from Saudi Arabia, Sudan, UAE, they are being repatriated, these domestic workers. And therefore, because of their mistreatment in the countries they were in, they could bring in major challenge in terms of our management of the pandemic. But they are being put into quarantine centers. The second problem is Djibouti is another area where a lot of the viruses are coming in. Puntland and Somaliland are not recognized governments, but a lot of our young people, to go to Saudi Arabia, they go through Puntland and Somaliland, but they're coming back now because of this. They cannot go there. Somalia is another country where the pandemic might be very serious if it comes in because of the conflicts that's going on in the country. So our borders are porous borders where people can move in freely. Contraband traders, they move in during the night so they can bring in the virus. So the government, I know, is putting up strategies and policies with the regional governments to be able to control this. But the point is, I understand why WHO is saying the next center of the pandemic could be Africa because of our poor health systems in this continent. I'll tell you, most African countries, most African governments, they don't even know people living outside the capital of that country. We're lucky in Ethiopia where we have sort of strong regional governments that are undertaking development programs and projects. But the point is, he is saying this because of the poor health system. But we've seen the developed nations like the United States who cannot even provide ventilators to their hospitals. We've seen Spain and Italy where they are saying we don't treat people above the age of 80, let them die. So this virus is a very serious virus. It doesn't talk about wealth, it doesn't talk about the economic well-being. It attacks literally everybody. And now, so far, what it has attacked is the G8 nations.
Do you think this COVID will bring a new paradigm shift in global economy? The trend, I mean.
Well, you know, the post-COVID world is going to be different. I'll tell you that. For one, most writers in foreign policy and foreign affairs magazines, they're saying that China will emerge as a major power after this crisis, because they're saying this because China has managed the pandemic, although it started there, and China still has the fundamentals of its economic structure working. If you go to the United States, you have more people dying now in the United States than anywhere in the world. You have a political system that is literally in shambles. And therefore, they have to correct this immediately. America is a very creative and innovative country. Most innovations originate, of course, in the United States. But the administration has to work very, very quickly with the American states to be able to jumpstart the American economy again. But one of the biggest problems you have why China is going to emerge is because of President Trump's policy of making America great again and looking inward instead of looking globally. America has led globalization so far, and globalization has lifted billions of people out of poverty. It has lifted 900 million people out of poverty in China alone. So if President Trump is going against globalization and looking only at America, then others are going to fit in this empty space And the main candidate is China, of course, with its huge foreign currency reserves and huge potential for production. China is technically a factory for the whole world now.
To what extent will Ethiopia's foreign exchange be harmed due to this COVID?
Ethiopia's foreign exchange problems, let's see, where do we get the money in terms of foreign exchange? One is, of course, exports. It hovers around $3 billion, but it goes down. It has never improved. We've been devaluing the birr because we want to increase our exports. That hasn't worked. In economics and finance, there is what you call a J curve in the graph, where when you devalue your currency, first, import costs go high, very high, export costs don't improve. But eventually, these things will come to a lag phase, where the graph flattens. But the problem is we're not using these fundamental economic and financial concepts in our management of the economy. Number two, we don't have international financial banks here. If you take Kenya, Tanzania, Uganda, even Djibouti, next door, have foreign banks which have huge capital. And these banks are the banks that provide loans to the private sector to be able to develop industrial parks. Kenya, for example, has only 15% of its area as arable land, but it has more agricultural exports than Ethiopia. Because the private sector there has more than 100 industrial parks. They have developed the cut flower industry, they have developed the horticulture industry, they have developed the tourism industry with its infrastructure. And these countries are supported by huge finance coming from private financial institutions. You know, the era where you live in borrowed time and money is over now in the world. After this COVID crisis, countries are going to look into their own stimulus packages to be able to bring their economy to a certain level. This is like the end of the Second World War, where every country now needs funding. So you have to rely on your own. And therefore, I think one thing that the new economic policy of Prime Minister Abiy doesn't consider is liberalizing the financial sector. What is the argument for that? The argument is they say they are going to kill our indigenous banks. No, that's not going to happen. Take Singapore, take Hong Kong, take Dubai next door. Indigenous banks were protected by law. Even China. China only released the indigenous banks to compete with the international banks only 2 months before now. So you can protect the indigenous banks. Most of what the foreign banks will do is they will provide capital loans for huge investments like dams, other infrastructure, government loans, and industrial parks. They cannot open saving accounts for local people. They cannot open branches. They only work with one headquarter branch. So it is the indigenous banks that will benefit when they open letters of credit through them. It's the indigenous banks that will provide, that will get the foreign currency. So our foreign currency problem is not a problem of getting it. The problem is because of our financial policy. It's completely closed. Imagine the Grand Renaissance Dam costs about $5 billion. All our banks combined don't have a loan capital that can build that dam. But if you bring international financial institutions here, foreign banks, to work, like Commerce Bank has opened a branch office here probably for the last 10 years, but it's not functional. Standard Chartered has opened a branch office here. But these banks can aggregate a loan structure for Ethiopia to be able to do these major investments. And also, when these banks provide a loan, like the Grand Renaissance Dam was supposed to be completed 3 years ago. If these banks were there with their money in that project, they would have done it by then. They will control it, they will focus on their returns, and therefore they will put some prudence into public investment.
Let's talk the impact of COVID again on the gross national product and that of the GDP, the gross domestic product, its impact.
Well, you know, the impact of the coronavirus on the GDP is going to be very, very strong. For one, basically GDP is measured as the collective output of our goods and services, or probably you can use the consumption to measure it. But the point here is, so far our GDP growth parameters have been determined by the growth of the service sector, by the growth of the agricultural sector. So that's not going to change very much, because the agricultural sector much depends on the availability of rain, because much of our agriculture is rain-fed. The service sector might go down a little bit, because transactions have to be lowered down. And with the serious challenge we have with foreign currency in Ethiopia today, the service sector might not get the kind of foreign inputs that they need for, like the construction sector, for example, might not get the finishing materials for their building, which is imported from China or Spain. So IMF definitely has downgraded our GDP level to probably 6%, but that is still very high. Any growth above 5% is phenomenal. It's, you call it a rapid growth. Of course, we're not growing the way China has been growing at double digit, for almost 30 years. But China is now growing at 4%, 3%. Europe and the US are looking at 1% growth, and the IMF is projecting a global growth of probably 2%. So I don't think we'll be affected very much, even growing at 6%. The main arena is, what do we do with the human development aspect? Look at what we're saying because of this COVID-19. You have to sanitize your hands. You have to wash your hands. You have to keep yourself clean. You have to keep distancing from other people. You have to be food secure. That means you have to eat to live. So if the Ethiopian government now focuses on human development, it's not just safety nets, giving money to farmers who should be busy in their farms farming. While this is an important aspect of prevention and preparedness, we have to look into growing each family in Ethiopia. And our universities should be able to do this. They should be able to provide, for example, about 20 of my master's students and 3 of my PhD students at Addis Ababa University have produced dissertations that would be helpful to do these things. But this research is not going into the government, into our House of Representatives, and into the regional governments. So the academia should come to help the government, not just being employed in government. I mean, they are government universities in the first place, but they should be invited to help. So far, what we've been doing is every ruling party has only been calling people that they like or they want to endorse their political views. What we have to do is we have to have different views coming in, and the government is there to serve the people. We shouldn't keep our population under food aid for a long time. Mind you, the Oxford Dictionary, when they were defining famine, the next thing you find is Ethiopia. Now that has been taken out because of a lot of lobby by the Ethiopian diaspora. But really, we shouldn't be an epitome of famine. We have the resources, both human and physical resources, natural resources, and we can use it. So my main question now is, GDP is not a good measure of an economy, by the way. It shows you the health of the economy, but it doesn't show you the health of the people living in that economy. So we have other indicators like the Human Development Index developed by UNDP. I've been working on that index for 15 years with UNDP in New York and in different parts of Africa when I was a permanent employee of the UN. So the Human Development Index is an important way of defining how each citizen is living.
Okay, dear viewers, you have been watching Talk to OBN. Thank you for watching. Goodbye.